Okay, so these are the supplements that we work with when it comes to hormone imbalances. And we started off talking about estrogen detoxes, such as calcium D-Glucarate, N-Acetyl-L-Cysteine, and Diindomethylene. Really powerful, powerful, powerful supplements. They are incredible for estrogen detoxing. However, I want to just highlight that earlier on in where I was in my clinic, I would definitely have gone, oh, this person's estrogen dominant, let's get them on an estrogen detoxer. But actually now my thought process has changed a little bit, because especially if a woman's in perimenopause, her estrogen's where it's supposed to be. It's the focus on, let's work on the progesterone. I tend to think estrogen detoxes now, when I've got particularly the younger women with terrible acne, I've got the women who are trying Eutrogestin, or and it's not working and they're feeling awful. And then I'm thinking about that xenoestrogen aspect. So let's just be really clear. There's the two types of estrogen. There's our estrogen, don't want to be binary, but let's call it the good, delicious estrogen. And then there's the xenoestrogens that are kind of like just going around and around and around the body and not clearing. They're the ones that we often want to clear. So when women aren't getting a response from Eutrogestin, I'm like, okay, let's have a little look at sorting out that gut. And they've maybe got a history of gut issues. That's when I'm thinking about the estrogen detoxes. I'm thinking estrogen detoxes, like I said, younger people with really bad acne. I'm thinking estrogen detoxes if they've had a history of being on the contraceptive pill, or they've been on a really, they have been fallen foul of the culture of high dose estrogen therapy that we've seen coming from a lot of celebrity doctors and coming from a lot of GPs. That's then actually, and they're just broken with, in some cases, 3,000 times the amount of estrogen that they're supposed to have in their body. That's when I'm thinking about an estrogen detoxer. I don't just think about it as standard just because this woman is in perimenopause, because I would rather be promoting that progesterone boosting, all the ways that Laura said. Magnesium, essential for hormone balance, helps regulate the pituitary gland so that we actually get that better support in the endocrine system. Zinc increases the production of FSH, which in turn causes ovulation and leads to the production of progesterone. So that's really important. B6 has been shown to help progesterone levels. Vitamin C, D and omega-3 lowers androgens and adaptogens. Now, particularly for progesterone, chaste tree is a progesterone booster. Some women don't get on with it. It can actually make you a little bit, what's the word, anorgasmic. So it can actually inhibit the orgasm response. So that's why it's called chaste tree, actually. Little nerdy fact there. But there are other adaptogens. So what's my other one that I really like? It would be great if I actually was able to retain a memory with my menopause. Not Shazandra, the other one, Shatavari. Got there. I was like, it's another one beginning with a sh. Shatavari, lovely, lovely, lovely. Can, if they don't get on with chaste tree. And L-arginine, which is an amino acid found in high protein foods and is important in the production of nitric acid, which aids blood circulation. So again, how are we clearing everything out and getting this progesterone boosted?